On the Medical Watch for you this afternoon, the medical detectives that detect cancer.
Machines scan, surgeons cut, but it's a special type of doctor who actually determines the presence of cancer in a patient. Take a look at how they do it.
This is prostate samples.
The tissue and tumor specimens arrive on orange blocks from the operating room.
This is multiple specimens embedded in the one block. Our goal is to make sure that they are evenly and fully present on the surface of the block.
It's an area of the hospital patients never see, but the doctors and technologists who work in the pathology lab see just about everything.
I would say the average is 1,100 blocks like that daily, 1,100. But there's the day when we have a 2,000.
The tissue is thinly sliced, placed in water, and scooped up by a slide. The next step, staining. The slides are submerged in a chemical or dye. The process helps accentuate certain features of the cells. They come out in color, ready to be scrutinized.
So these are the cancer cells here, large abnormal cells that have lost the normal amount of cytoplasm. When we're looking at cells, and especially in preventive disease, we have to find the abnormal amongst a lot of normal.
It takes a trained eye to see the subtle signs. The pathology of the cells determines the origin of the cancer and best course of treatment for the patient.
So it confirms for me that this was a breast tumor. And then we do other markers that determine the prognosis and treatment options for this patient.
Across the street, they're digging even deeper.
This is a cell. This is this person's entire genome on a screen. This is this person's everything. This is what makes them them.
Called cytogenetics, the technology allows the pathology team to see chromosomal variances in blood, bone marrow, and tissue. The technique may change how doctors treat rare cancers.
They say, we think this person has acute myeloid leukemia. We look at it and we can help fine-tune that into a subtype of cancer. So if we find something that historically has a very bad prognosis, of which there are several things, they will often increase the amount of chemo or the type of chemo that the patient gets.
And that is one of the reasons cancer treatment is improving. The advances in pathology help lessen the toxic effects of treatment. And all those glass slides in the lab, what happens? Well, there is a major effort underway to convert them to digital, the tech age, right?
Yeah.
Okay.
Thanks, Lourdes.